Hi, my name is Megan Soroy, and I am taking the class Healthcare Policy and Economics, and I have chosen to do a PowerPoint on global advocacy for promoting women and children's health. The main purpose of this PowerPoint is to be able to look at advocacy for vulnerable people at a global level. The global health objectives. First, I'm going to explain the SDG, which is the Sustainable Developmental Goals. Then I will do a description of global health recommendation and identification of the vulnerable population that I have chosen, the current healthcare policies that impact women and children survival rates, the global recommendation relevant to this vulnerable population, and the importance of funding to invest in our global women and children. The explanation of the SDG, Sustainable Developmental Goals. This came from the United Nations, who had developed MDGs, which were Millennial Developmental Goals. This was global health goals that made actions happen to better lives globally. Global health challenges affect every country. As we see now with the pandemics, it's also going to affect economy, trade, politics is the driving force, but also it affects our health, poverty, funding, as well as the population growth. With that, new global health goals placed an emphasis on impacting more populations that incorporated the vulnerable. Despite progress, the goals of reducing child mortality and improving maternal health were not realized. The National Academies of Science, Engineering, and Medicine are a leader in global health science. They look at global health risk assessments, and they also look at security worldwide. The CGH is a committee on global health. They conducted in 2017 a consensus on global health priorities, threats, and challenges. One of the focuses was on promoting women and children's health. The global recommendation to improve survival in women and children. Women and children contribute to society and growing economics. The ways we are going to look at impacting is to prevent maternal deaths, preventing child mortality, especially those under 5 years old, and preventing premature infant deaths. The description of the global health recommendation. The SDG that I chose to discuss was the Global Health Report from 2017. We're to look at immunizations, integrating management of child illness, nutrition for pregnant women, newborns, infants, and children, prenatal care and safe deliveries, and families accessing contraceptives and family planning. Current policies that impact improvements in women health and children are the ENAP, the Every Newborn Action Plan. This is a focus that's proposing that there are interventions for both women and babies to be delivered at the same place so that healthcare providers and a team will be able to impact those health outcomes for both of them. This would be able to allocate financial resources to maternal and newborn health. We also need to adopt legislation for maternal deaths and newborn births. 50% has been where they are not documented, so we do not have the latest updates on all of those women and children's death or births. We need to invest and develop adapting new devices for mothers and newborns. We need to be able to campaign for behavioral changes as well as social changes that include the poorest and the most vulnerable. This could be by looking at social determinants of health. 5 strategic objectives that were imposed to implement were to strengthen and invest in care during the labor, birth, as well as the first day and week of life. This would be able to improve the quality of maternal and newborn care. We need to research every woman and newborn to be able to reach all their abilities to reduce their inequities. We need to be able to harness the power of the parents, families, and communities. This is by teaching them the educational, by doing the campaigns, as well as reaching out for social behavior changes. We also, as we mentioned, need to be able to measure births and deaths of newborns to be able to track and measure for accountability. Other current healthcare policies that impact improvements in women and children were the U.S. Agency for International Development. They are looking, as we had mentioned, to legislate for immunizations to be up to date. We want to look at and educate hand hygiene practices, nutrition, and water, as we are impacting as well with the coronavirus. We also want to encourage prenatal care, and management of child illness needs to be taken into effect to reduce chronic illnesses, as so that you don't have deaths reported for children under the age of 5. We need to improve family planning, as well as improve the access for those to have contraceptives. The global health and the future role of the United States. A more effective strategy would be to focus on all the way from infant children through adolescence into women who go into adulthood, whether they are just pregnant or not. Keeping women pregnant while they are safe, two major impactions that they have noticed in studies have been that interventions where you have a trained attendant at birth, as well as the patient has access to an urgent OB facility at every birth. Many women and children's death are preventable. Increasing the education and knowledge for them is key for their survival, as well as being able to impact the rates for mortality. There's a ripple effect of survival for women and children. This goes into all communities that are affected by women and children's survival rates. The global recommendation relevant to the vulnerable population. Foreign assistance is a charity program, as we know, and also it's a highly political issue. But if you do not invest in the children or the women, you are not going to have future populations, as well as the economic can be hit as hard as the world is also impacted. Improving the survival of women and children. The benefits of investment in women and children will extend beyond health and translate into increased economic prosperity. This strengthens societal bonds and improves community resilience. This makes into a wide investment opportunity for the United States. You need to do research, finance, and invest in our women and children globally. The summarization, the way that healthcare professionals can advocate to impact the survival rate of all these women and children globally. There are ways that you can do basic training curriculum at all school age level teachings for mothers to learn how to take care of their children. You need to insist in immunizations to be given to all. You need to be able to teach low-cost educational activities to be able to make an impact for early childhood development. As we had mentioned, you need to assist in registering all births. Just like we had mentioned, 50% of births are not registered, and with those birth certificates, they're able to have self-identity. They're able to, maybe the rates are showing higher children are finishing at least primary school, protecting some of those trafficked children. Promoting positive environments and decreasing abuse assists also in greater brain development. Educating healthcare workers, teaching them the importance of not just formula feeding, but that mothers need to breastfeed their children for 6 months. This promotes proper nutrition for newborns to gain weight, as well as brain development. As well as we need to promote, as we had mentioned, the deliveries to take place in a facility. This helps monumentally in decreasing maternal and newborn death. The reasoning for funding to increase the survival of women and children. Children are our future, as well as women. Without women and children, you're not going to have a future in any society. But early and continued investments in children helps them grow and develop into healthy and productive adults. This leads to increasing our economic growth. These are the references for my presentation and why I feel that the importance for having the SDG on focusing on women and children is extremely important, just not only for being able to better our society in the future, but also to be able to have a successful and properly functioning society. Thank you.